That is one of the questions we have today for News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you so much for coming in today, as always.
You're welcome. Good to see you.
Well, here's our first question. We all worry about a lot of things, especially given these economic times we're living in, but can depression be caused by worrying too much?
I mean, the reality is absolutely. I mean, worrying is a well-known cause of depression. I mean, what is worrying? Worrying is concern, all right, or mental distress caused by concern, and that concern is typically something that is impending or about to happen or anticipated. So what happens is you can't really feel like you get your arms around that problem, and so what it does is it obviously takes a toll on you, and you start to get more and more depressed about it. Also, worrying affects your sleep, and what it does is it increases your REM sleep. What increasing your REM sleep does is allows you to feel less well-rested. You wake up in the morning, you feel more tired, you feel less energetic, you feel more hopeless, and thus again it creates this cycle of depression because then you create more worrying. So it's a big problem. So what do you really need to do to stop it? Well, it's actually a sophisticated process because it's a mental problem, and so you need to get control over that concern. And the way to do that, there's multiple steps. If you want to find out more about that, I'll be happy to give you some information. Just email me at the WPTV.com website, and I'll forward that to you.
Okay, wow, interesting information to know. Well, now on to our next question. Does multitasking improve your memory, or does it make it easier to forget things?
Yeah, I mean, they had this really elaborate study to really prove what sort of we already knew, and that is that, yeah, multitasking does impair your memory. I mean, if you think about it, memory, in order to commit something to memory, you have to think about it, you have to focus on it, and really it needs to be repeated in your mind. Well, when you have frequent interruptions, whatever it was that you were thinking about before that interruption is more likely to get lost, and you're not going to remember it.
Okay.
So it's very, very common. Matter of fact, some experts will say that if you're on your cell phone or texting while driving, it is equal to the impairment that you will have if you're drunk. So
wow.
It's serious. So what do you do about it? Well, a couple of quick tips, but there's a lot that you can do about it. Clearly, number one is if you're going to multitask, pair a mental activity with a physical one. Meaning, if you're on the phone, vacuum or fold clothes. Don't try to do two mental activities at once. And I'm very guilty of that. In other words, you're reading something and you're on the phone, and I got to tell you, I forget what I'm reading and what I'm talking about. So it's very common. You don't want to do that. The other thing is obviously if you are reading, put away the cell phone. Turn it off. Don't just put it aside and think that if you get a phone call or a text, ignoring it will work, because that buzz is distracting you and you're going to more likely forget what you're reading. So
I too am guilty of that. I frequently put somebody on speakerphone and will send a text message at the same time. Sorry, Dad.
Excuse me, wait a minute. No,
well, our final question, we were limited on time, so we'll get to this one quickly. Can exercising lead to headaches?
Yeah, again, very common cause. We know that for a fact. Matter of fact, what it does is that creates more blood flow that's necessary to the brain, scalp, and to the head, and what that does is it dilates the blood vessels and can lead to something called exertional headaches. We also know that migraine sufferers absolutely are more predisposed to exertional headaches. In reality, if you have a migraine, we know that if you exercise or do anything exertional, that headache is going to get worse. So clearly it's something that needs to be either attenuated or avoided if you have frequent headaches. So what to do for it? Well, the treatment is relatively similar to the rest of the way we treat headaches. Pain medications, anti-inflammatories, and plenty of hydration. But one thing I want to make sure, and that is that if it's your first and severe, it's the first time you've gotten an exertional headache, or if it's the worst, I want you to come see us because we have to rule out a more serious cause of that headache.
Well, thank you so much for great information. Also, thank you for giving me a reason not to exercise and just to go sit down when I leave work today.
I'm glad I could help.
Thank you for coming in, Dr. Soria. And of course, we'll see you next week. We'll be right back.